The reason why I left ICU, I said like I don't want to continue working in that kind of environment. Working abroad alone is sometimes can be really sad and depressing. There's just you at the end of the day. You don't have your family. Alam mo yun, wala kayong relatives. And it's just you. Alam mo yun, parang ikaw lang. After a very tiring day, after a very exhausting day at work, a very depressing day, kasi namatayan ka ng pasyente. And kasi yung pasyente na so, yun nga. Welcome back to the channel. Wala tayong ilaw. I'll put some light. So guys, dahil nag-commit ako sa inyo na every Sunday mag-vlog tayo or mag-upload ako ng video, even na hindi pa ako tapos gawa ng script. I was doing the script 2 days ago, and then yesterday na busy ako sa isang agency shift, which is talagang, guys, ang layo ng dinrive ko. Parang 2 hours ako nag-drive papunta and 2 hours pabalik. It was a 10-hour shift. But sobrang layo talaga nung biniyahe. So, nakakapagod talaga. And then, today naman, guys, matend ako ng training. So, meron akong pediatric life support. Kakauwi ko lang. And because I want to spend time with you, we're gonna do a vlog, even though it's not yet finished. The topic of this vlog is just a personal parang sharing sa inyo, guys, na giving you pros and cons about working in the ICU and working in PACU. So, this video, I think, might give you an insight if you're in that parang thinking process of where you want to work, whether ICU or PACU. The first one ng pros from being a staff nurse in ICU is there are endless opportunity to grow and learn professionally. So, dahil sobrang lawak ng cover ng intensive care unit, sobrang dami mong pwedeng matutunan talaga. Meron kang i-mentor ka for, usually it's 3 to 6 months. So, kapag nakita nila within 3 months na okay ka na, i-let go ka nila to handle your own patients. So, if mahilig kayo mag-aral, never ending, I would really go for ICU. So, the other thing is that the diversity of everything from equipment to medications to procedures, yung collaboration with the multidisciplinary team, talagang may direct kayong communication with every single one of them. Diversity ng mga na-experience mo, equipments from, nagpunta ako dito sa Ireland na I didn't know or I don't know how to operate a dialysis machine. Specifically, yung continuous renal replacement therapy or yung CRRT. And then the other thing is that before ako magpunta dito sa Ireland, hindi talaga nangingialam sa ventilators. Here, you're expected to know a lot. Guys, yung mga sinasabi ko, ito lang yung mga based on my own experience. You probably kind of experienced this or maybe experience mo pa ay mas grabe pa. But these are just my own experiences na dito ko lang natutunan. So, let's go down to number 3. Ang number 3 ko na pros dito ay patient ratio is 1:1. For the past 4 years na nagtrabaho ko sa ICU dito, I never had to handle 2 patients at the same time other than if nag-discharge ako ng pasyente and nag-admit ako ng panibago. Yun lang the only time na I had to handle 2 patients. Parang nag-handle ako ng 2 patients the same day pero 1 patient at a time lang. When I worked in Saudi, pwede kami umabot ng 1:3 patients. Kahit 2 ventilated patients, pinapahawak sa amin doon before. So yung cons, guys, number 1 is your patient assignment can be very heavy and very task demanding. What I'm saying is that, kunyari matapos ko yung vital signs, dialysis obs or dialysis requirements for the hour, medications, by the time na na-record ko na silang lahat, kailangan ko na namang gawin ulit again. And then, on top of that, meron ka na namang kailangan gawin kasi may nag-rounds or nag-deteriorate yung pasyente, kailangan gawin procedure, kailangan mo punta sa theater, kailangan mag-CT scan, kailangan mo punta sa MRI, or dumating yung surgical team, dumating yung another team. So parang, or may complications sa relatives, or may complications sa ventilator, and all of those things, talagang minsan nagpapatong-patong sila. And it can be very heavy. I remember one time, bago pa lang ako sa ICU, I went out of my room, spoke to one of the senior nurses there, and then at that time, and then I asked her, and she was like, "Are you okay?" Kasi patapos na yung mga trabaho ng mga nurses. And I was like, I cannot manage my patient in my room. I need a hand. I need help because I need to do a lot of things, and I haven't done a single thing because I was doing XYZ for my patient. Asking for help is not a problem, and you should probably do it sooner kapag talagang if you need a hand. The other con here is high stress environment, emotionally, mentally, and physically. So this is the one thing that got me the most is yung stress talaga. So what I find, guys, is that yun parang the first few minutes mo sa first few minutes ko, this is for me, okay? This is just a disclaimer. This is how I felt. Yung first few minutes mo pa lang sa ICU is very stressful na kasi talagang sasabihin nila na lahat na nangyari within the night or within the day, depende kung anong shift kayo. Patients can deteriorate, relatives come and go, relatives will, there's a lot of grief happening in the environment. Especially most of the people who comes to the ICU or goes to the ICU are elderly people who might be at the end of their life. That's why I felt that it was very emotionally stressful and draining because of all those things that I've mentioned. And then physically naman, guys, because alam niyo naman, guys, sa 12-hour shift, sometimes it can be 13-hour shift because mag-handover ka pa, and usually during the handover time, magtotoxic yung pasyente mo and hindi ka makalis kasi you haven't handed over yet fully. Parang nasa middle ka pala na handover mo at nag-arrest yung pasyente or nag-bowel movement yung pasyente and hindi mo maiwanan kasi ayaw mo namang ipasa sa next shift yung ganong state ng pasyente. Those things can happen, so it can drag you for like yung 12 hours to 13 pataas na hours. So talagang mapapagod ka physically. So number 3, guys, na nilagay ko dito sa con is it can be a very competitive environment. Everybody's competing for, parang a higher level. At the moment, I just want to, have a peaceful, steady, and quiet life when it comes to nursing. Pros and cons ng PACU, hindi ko siya natapos. So first of all, guys, alam niyo naman, PACU ay dun pupunta yung mga pasyente after nilang ng operation sa theater. That's why it's called recovery room kasi dun sila magre-recover before sila pupunta sa mga designated wards nila. So first of all, yung pro sa PACU, wala kang prolonged na contact dun sa patient kasi if they have beds in the wards, wala kang masyadong prolonged na contact because once they're recovered from being anesthetized, they're awake, they're stable, they're not in pain, you move them out from the recovery room to the ward. Then, the patient ratio is not bad as well. Pag dalawa na yung pasyente mo, usually hindi ka na pinag-handle ng ibang patient unless ma-transfer mo na yung isa sa ward or pag nag-move out na silang dalawa. The other thing is that the schedule, guys. Yung schedule pag sa recovery, unlike sa ICU, schedule is like 12 hours fixed, diba? Sa recovery, can be flexible. If pwede kang mag 8 to 6, pwede kang mag 9 to 7, pwede kang mag 10 to 7, pwede kang mag on-call ng 2 p.m. on-call, which is the next day. Pagdating sa mga cons sa recovery, parang wala naman ako masyadong cons, but then I think what can be a con is that what you're doing in recovery can be repetitive. So day in, day out, you see a lot of cases depending on which hospital, where hospital you're working. Once you've seen this case and paulit-ulit yung gagawin mo, there can be variation. Minsan stressful, minsan may mga complicated na pasyente, but majority will be kind of the same, more or less. If hindi nyo gusto yung mga ganun na routinary or parang repetitive na, that would be one of the cons. The reason why I left ICU, I think I was really depleted during the pandemic. That was 2 years out of 4 years that I spent in the ICU here. Parang I've seen a lot of grief, I've seen a lot of dying. I've seen the worst of the worst. Maybe I felt that I needed a change, and then I really felt that the ICU environment was really depressing. At that point, I said, I don't want to continue working in that kind of environment na it's just very sad. Alam niyo, guys, pag nag-work kayo sa abroad, ewan ko, this is just how I felt. Like working abroad alone is sometimes can be really sad and depressing. Especially if you're living on your own, even if you're living with flatmates or with friends, parang it can be isolating sometimes na there's just you at the end of the day. You don't have your family, you don't have your close friends, alam mo yun, wala kayong relatives, and it's just you. Alam mo yun, parang ikaw lang. After a very tiring day, after a very exhausting day at work, a very depressing day, kasi namatayan ka ng pasyente, and kasi yung pasyente na So, yun nga. So, after a tiring day, after a depressing day in the ICU, physically, emotionally, and mentally, you come home. Yeah, you come home sa bahay mo, or sa flat mo, or sa room mo. Yeah, so you come home sa room mo at the end of the day, and you're by yourself, and then you already had a depressing day. It's different. It's still different when you're at home, sa Philippines, and malungkot siya. So, malungkot talaga siya, guys, and especially when I was doing night shifts, yung parang 4 or 7 nights or 4 nights, and then meron kaming week off, tas 3 nights again. During the winter time, when it's dark and it's very cold, naisip niyo yung scenario, parang malungkot sa work, dark, cold environment, and then you're by yourself. You're by yourself here kasi wala yung family mo. So it really became so sad, so lonely. So now, at the moment, nung nagpalipat ako sa recovery room or the post-anesthetic care unit, guys, things got a little bit better. The patients that we handle are the patients who, when they wake up, usually they're glad that the operation is over. So, cases are less depressing. It's less sinister. Yung sitwasyon ng mga nasa recovery room is less sinister, less yung iyakan, and less yung grief. Alam mo yun? Mas lighter yung feeling compared when I was working in the ICU. And then also yung hours, wala kasing nights dito sa recovery room, no? Yeah, normal yung tulog mo sa gabi, which it really helps when you're feeling lonely or depressed. And obviously, these fur buddies, to mga to, life is less lonelier, life is less sad here sa abroad. He keeps us happy and he keeps us, entertained and busy as well. That's it. That's the vlog, guys. I hope na you learn something from this experience, like from what I've shared to you. And sorry that I became so emotional. I don't know why, pero it just suddenly, felt the loneliness I felt when I was experiencing it last year and telling the story now. Parang bumalik sa akin yung feeling. I think that's why I was a bit emotional. Thank you for spending time with me again today. And once again, guys, I want to remind you that you are capable of doing anything that you put your heart and your mind into. Continue pursuing your dreams, your passions, your aspirations in life. I'll see you on the next vlog, and I hope you have a good week ahead of you. Goodbye.
I've been feeling so small. Watch the clock